Assalamu alaikum. Another case, and we are looking at this case. This is where possibility of having a bridge. Okay, what do we say about this? Remaining root. How long do I stay waiting after I remove this? Definitely you're not going to do a bridge over it, صح? Why? Why don't we do leaving remaining roots under bridges?
لأنه هو كنار عامل للبكتيريا.
Okay, infection route is open. Okay, what else?
راح يصير له super eruption مع
Super eruption. What else? Dentine exposed to the oral cavity. What will happen to it? Caries. Caries. You'll have caries in it. Okay. What else? Failure of the bridge. What will cause that? Food impaction. How are you going to clean a tooth like this? Okay. If you're going to you have to remove it, or there's something else called, but this is like a very specialized technique where they with a sound tooth, sound root, sound no endo, something very clean, they might leave it and bury it in the bone. They want to preserve the bone around it for later implants. This is advanced cases, okay? It's very specialized. But I'm talking about this root has been treated endo. No, definitely going to remove
and
it.
resorting.
Yes. Still, we haven't talked about this. Still, we're here.
Yes.
Suppose I'm going to extract it. Suppose this was a well-developed tooth and no problems in it. After extraction of remaining root, how much do I wait? 2 weeks? Before final impression, definitely.
3 months.
3 months is it enough?
Subjective. على حسب الهيلينج عند البيشنت. شهر ونص يعني الافريج.
No, it's preferred. If you want it 100%, you have to wait for more than 6 months.
6 months?
6 months. Can you do a bridge? Can you do a bridge? You can do it a temporary bridge.
Yes.
Acrylic bridge, something temporary. Or you cement your bridge temporary, but once more you have to build on it later on. But we're talking about bridges. What will happen if I don't observe this and let's say somebody had a root extracted or a tooth extracted less than 1 month, and I did a bridge. What will happen? What are the consequences of this? Bone resorption. شو اللي بيصير تحت؟
البريبريشن تبعي حيخرب لأنه يعني حيصير تلتنج للأسنان.
No, the bridge will be fixing to both teeth. Okay, my question was, if suppose this was a good tooth, and this was a good tooth without any problems, and we had a root or a tooth, and we extracted it, and we are intending to do a bridge, okay? Say I waited for 1 month. What will happen later on? Loose? No. The bridges are fixed here and here. Impaction of food underneath. بصير ايش؟ First consequence. Bone resorption. First consequence. شو بيصير تحت البونتك؟ Food accumulation and space. Okay? Unless you have done it as a through and through. If you've done it through and through, you're okay. If you had done it a design through and through, it's okay. But if you have done a different design with the ridge labs, the ridge will go down. So what will happen beneath the ridge lab? You will have food impaction and inflammation and problems. So we have to wait 3 to 6 months, preferably 6 months. If you want to wait 3, you might do that, but you have to temporarily cement it to evaluate. The resorption between 3 and 6 months is if it's huge, you either build on the crown or you replace it. Okay. What will happen also to the margin of the crowns aesthetically?
لما يصير في رح تصير لما يصير في resorption البون رح تصير expose the margin.
Okay, yeah, that will happen because soft tissue will follow the bone that has resolved. So the soft tissue covering the margins and aesthetically are now recessed, so the margins are exposed now. Okay, they are more exposed, so aesthetically. Will there be a torque if the teeth are sound? Why should be? Because bridges are a fixation technique. Teeth are fixed in place, huh? Even with the grade 1 mobility, this becomes fixed if it was a natural tooth. I'm not talking about endodontically treated, not endodontically treated tooth. Okay. So now this case we have an endodontic treatment. It's a case. How do you judge this?
إنه failure treatment بده retreatment.
Failure? It's not failure yet.
بس هو short.
No, I mean failure. When we say failure, we are talking about an emergency exacerbation of an inflammation or infection or abscess. There is an emergency related to it. This is called failure.
widening بالVDL
We will say it's insufficient.
insufficient.
Insufficient. Is this widening going through and through and we have a tunnel where we have perio-endo lesion? I'm not sure. I have to evaluate. Usually those that have an endo-perio lesion, you'll have mobility in them.
Yes.
Okay, so clinical evaluation. So the filling is insufficient. But there's no apical lesion, but insufficient.
Coronal seal is
Coronal seal is not clear. Yes, yes.
هلا
Yeah,
بنرجع عن كورونال سيل. هلا لو إن كانت الروت insufficient مش البريبريشن
Root canal.
كنت كفياتها مش sufficient.
Length. You mean length of filling?
بالضبط.
Okay.
هلا هي طالما مش مأثرة علي ليش أغير؟
Good, because what are the problems with this? You
هون
don't
في
see
عندي بلب تيشو
tissue. It might be necrotic. Yes.
بس طالما إنها هي جود سيل في عليها جود سيل ما بيجي
Where is the good seal? I'm not sure about the
لو
good seal.
إنه كان من فوق جود
coronal
If
seal.
apicectomy.
We can't leave a short.
Okay. If you want, okay, good question. Suppose I have a good endo, not this one. I have a good endo, but it's short. Okay. Okay, and I have sufficient coronal seal, and I've done my bridge, and I want to do my bridge. I want to do my bridge. I have maybe some fillings or so on, and I want to do a bridge. Okay. What do? I keep guarded prognosis. Guarded that means I'm bringing the patient back and guarding what happened to him. If any exacerbation or something happens, I would do apicectomy. Okay? So once more, it's another guarded prognosis. Do I not do a bridge? I prefer to retreat and do something sound. But what happens if the patient insisted he doesn't want to do it and he wants a bridge? Okay? You have to sign them on guarded prognosis. They have to recall, do the recalls, there is a possibility of so and so and so. You have to come every 6 months. Some patients accept this. And then you will find that the tooth will serve them 2-3 years before you need an emergency apicectomy for that case. But do we leave it for chance?
No.
No, we are advanced now. If it was like 10 years before or 15 years before, this would be okay, acceptable. But here now, retreatments are so easy. Retreatments are so easy. Okay, do you see the coronal seal? What do you comment on the coronal seal?
Compromised.
It's now compromised. You see the space between the filling and the root. So it's compromised. That means this might be infected.
Yes.
So don't do bridge on infected stuff. So we were talking about the scenario where we have good endo but short. Good, excellent endo with short from the root, and we do later on do a post. But this post, look at the seal around it, the coronal seal. Here it's interrupted totally.
Yes.
Here there is space.
Open margin.
We're not sure what happened here. So what do you do with this tooth? Retreatment? Do you extract?
No.
It's an option, but extreme option. Why do you go there? Why do we need to go there? It's still salvable. It's still salvable. If it was my sister or my mother or my daughter,
to retain it.
I will retain it. Huh? We need to retain teeth as much as possible to preserve bone. Preserve bone. Okay. Filling in enamel.
It's عادي.
Good. This is the best filling because you are going to remove it. Okay. If it was an MOD. If it was an MOD.
إذا بالإنامل it's okay.
In enamel, okay.
لا إذا عندي جود سيل عادي بعمل preparation.
If in dentine. Dentine.
إذا دنتين لا.
What's the problem after we prepare? The thickness of the no, the frill is there.
صح.
It's a simple MOD.
Cementation.
لا دكتور ممكن تصير restoration صغير
Thin section of restoration. So don't leave thin restorations unless you, don't prepare overfillings unless you have done them. If they were indenting. Because when I have done it by my hand, I know how deep it is. I know if I remove just the occlusal layer, I still have enough thickness. But if it wasn't me that done the filling, or I don't see it on the X-ray, especially with the composites and old composites, they were not opaque enough for you to see them on X-rays. صح? They were not opaque, old composites. So I'm not sure how deep it is. So I'd prefer that you remove it, then you place your own composite to ensure that the thickness left after the filling is sufficient. Yeah.
ليش ارد احط انا كمان كومبوزيت بالمني انا بقدر اخليها من ضمن الكراون نفسه ولا اعمل بريدج صح؟
Good. An excellent question. Excellent question. I will answer it in a moment in another paper. Excellent question. I'll answer it in another video.